The Trump administration says it's taking a step toward lowering drug costs in the U.S. On Friday, President Donald Trump unveiled his new pricing deals with new pharmaceutical businesses, 9 of those. The agreements call for the companies to sell their products to Medicaid at special prices and to launch new medication in the U.S. at those costs. The businesses will also sell some primary care and specialty medications on the Trump Rx online platform, which is scheduled to open in January. Now, it turns out being on the spectrum may not just apply to people. One scientist says dogs can experience a form of autism. Even though veterinarians won't formally diagnose it, Dr. Jacqueline Boyd, an animal scientist, says there's good evidence of biological signatures of neurodiversity in different species, particularly in dogs. Dogs can have structural and chemical differences in their brains similar to people diagnosed with autism.
They still have the same emotional reaction to the world, similar emotional states. It's recognizing that commonality.
While there's no formal diagnosis for autism or ADHD in dogs, vets often call it canine dysfunctional behavior, which is sometimes treated with medication or training. If you suspect your dog is neurodiverse, Dr. Boyd recommends getting a checkup at the vet and working with a trainer. Doctors are warning about surging cases of influenza. At least 1,900 people have died from the flu nationwide this season, including 3 children. The CDC says that 2 of those children's deaths were reported in just the last week. Jen Sullivan reports on the growing warning from doctors as millions of people get ready to gather for the holidays.
At the DC Public Health Lab, doctors are busy testing diseases that could become a public health concern.
The really only time that people see us is when there's a public health emergency.
Dr. Jocelyn Hauser is the director. She says doctors' offices and hospitals around the country send them swabs collected from patients.
We receive those samples and log them into our information system.
Those results are then sent to the Centers for Disease Control and Prevention. This year, the CDC is particularly concerned about growing cases of influenza. The latest data released Friday shows there have been at least 4.6 million flu cases so far this season, 49,000 hospitalizations, and 1,900 deaths in the U.S. alone. The dominant strain causing the surge in illnesses is subclade K, a mutation of influenza A.
We think that this clade K virus is evading population immunity, meaning more people are susceptible to infection.
While doctors in the CDC say the best protection is to get the flu vaccine, Johns Hopkins University professor Andrew Pekosh says this year the shot may not be enough.
It has mutations that may allow it to evade some, but not all, of the influenza vaccine-induced protection.
As millions of people prepare to travel and gather this week for the holidays, there's growing concern illnesses may spike, and cases are surging around the globe. Children, adults 65 and older, and those with underlying medical conditions are particularly vulnerable to the flu. Medical experts are urging everyone 6 months and older to get the flu vaccine. I'm Jen Sullivan reporting.